Good morning, everyone. Welcome to Montgomery County's press briefing and update on COVID-19. I am Dr. Valor, Chair of the Montgomery County Board of Commissioners. I'm here today with my colleague, Vice Chair Commissioner Ken Lawrence, and several members of our county team who I will introduce as we go. We are now in our 22nd month since our first cases of COVID-19 showed up here in Montgomery County on March the 7th, 2020. Today, you'll hear a number of updates from myself and our team as Montgomery County experiences an unprecedented number of cases of COVID-19, most likely due to the rapid spread of the Omicron variant through our county. As a physician and throughout this pandemic, I have used the data and the science to guide our response. Using that approach, much progress has been made during the past year. A year ago, very few individuals had the opportunity to be vaccinated, and we were fighting to get our fair share of vaccine into southeastern Pennsylvania. Today, we have approximately 90% of county residents age 5 and up having received at least one dose of vaccine. The majority are fully vaccinated and many are boosted. A year ago, there were 2 approved monoclonal antibody treatments for COVID-19. Today, 3 different monoclonal antibody treatments are available for use during early disease, as well as for pre- and post-exposure treatments. 2 different pills to treat COVID-19, Paxlovid and molnupiravir, taken by mouth, will begin to be available in the next week. Prioritizing in-person education and working closely with our schools and the Children's Hospital of Philadelphia, our Office of Public Health has helped build an infrastructure of support, including data analysis, pandemic liaisons, assurance testing, and test-to-stay programs that has enabled our 22 school districts to safely open this fall. And we continue to support our schools through weekly meetings with public school superintendents, bi-weekly meetings with our private school leadership, ongoing communication with COVID pandemic liaisons and school nurses, and 24/7 access to public health consultation, guidance, and recommendations. While COVID-19 remains with us, we now have effective diagnostic, preventive, and therapeutic tools to fight this virus. Most importantly, the safety and effectiveness of vaccines is clear. Vaccines are significantly reducing the severity of illness and likelihood of hospitalization. Masking indoors remains a simple but very effective tool to limit the spread of this airborne virus. And the availability of an effective pill to treat COVID-19 that can be taken outside of the hospital setting will also be very helpful. Next, I want to move on to our current numbers. So many of these graphs will look familiar to those of you who watched our briefings in the early months of this pandemic. This is our positivity graph as of December 30th, 2021. Currently, our rate is 19.41%. As a reminder, the orange line represents the number of PCR tests. And I do want to note that this is PCR tests only. This does not include antigen tests performed each day. And the blue line is the 14-day PCR positivity rate. And again, as of December the 30th, we are at 19.41%. The date tested graph is next. And again, as a reminder, the gray bars indicate the number of positive PCR cases, again, no antigen cases, on a given day. The red line is the 7-day average of all cases, which as of December the 30th is at 973.7. So again, the 7-day average of all cases as of December the 30th, 973.7 cases. And I do want to just note the orange and the yellow lines at the very bottom of the graph. As a reminder, those are the 7 and 14-day averages from our long-term care facilities. And while there has been a slight uptick in the last few days, those cases do still remain very low. And then next, we're going to share a graph that shows you the counties 7-day count of cases per 100,000 population. And this is really the easiest way to compare cases across different jurisdictions. For instance, if you wanted to compare one county to another or one state to another, because this corrects the data for the number of people that live in that particular jurisdiction. So again, this is our county 7-day incident rate per 100,000 residents. And you can see that we are in the low 800s with that count. I also want to take a moment to acknowledge the 1,457 Montgomery County residents whose lives have been lost as of yesterday due to COVID-19, and express our most heartfelt condolences to their family and friends. And I also want to acknowledge the many individuals who are suffering with symptoms of long COVID, a condition for which there is currently no clear treatment. And now I will turn the presentation over to Dr. Richard Lorraine, the Medical Director for our Office of Public Health, who will provide an update on vaccines.
Good morning, everyone, and it is a pleasure for us to be here with you today and be able to share this information. If I can have the slides up, please. All right, so it's important to note that COVID vaccination is still widely available in Montgomery County and the surrounding areas. This gives an update of the vaccinations that have been done in Montgomery County, really since the beginning, but particularly note the combined vaccinations that we have and the question about whether people are partially covered or fully covered. We have a significant percentage of the population who have received their full doses. Next slide, please. So I've also included a focus here from the Pennsylvania Department of Health vaccine dashboard, which looks at the vaccinations that we've given, particularly in the past 4 months, which is since the CDC has recommended third doses for immunocompromised people and booster doses for those who have had more than 5 or 6 months elapsed since the time of their second dose, if they had an mRNA vaccine such as Pfizer or Moderna. So you can note that we have had a significant increase during that time, and you can see with each increase in the graph, this is when a new group was made eligible by the FDA and CDC for either a third dose or booster doses. And we are continuing to have operations in multiple areas in Montgomery County. Next slide, please. So in addition to the county sites, which we'll look at on an additional slide, there are many, many other private locations which are offering COVID vaccines. The location of these sites can be found on the vaccines.gov website sponsored by the CDC. And you can put in your particular location and find sites that have open appointments for vaccine within anywhere from 10 to 50 miles of your location. Montgomery County has a fair amount of locations, both in pharmacies, medical facilities, and private medical offices, in addition to our county sites. So there is no shortage of availability for the vaccine. Next slide, please. Montgomery County, in conjunction with a number of community partners, has sponsored a series of town halls, which have been recorded and are available for replay on YouTube. In these town halls, we have local health experts who answer questions from the community for a fairly wide range of topics relating to COVID, but the focus has been on vaccines and immunization. Many, many of the questions that people have are answered in these videos. So we encourage people to go there and view these videos, which will be able to give them a lot of information regarding immunization. Next slide, please. So here's a location of our Montgomery County vaccine clinics. We have 4 of them currently located in Norristown, Pottstown, Willow Grove, and King of Prussia. The hours and dates are indicated there, and you can go to our website to register for those who have a problem or don't have connectivity. We do have a hotline at 833-875-3967, where you will be assisted in making an appointment. A couple comments about current status with vaccines. There has been a lot in the news recently over the past week or so, where the FDA has extended recommendations, particularly for the Pfizer vaccine. And they have recommended, number one, shortening the interval for the booster dose from 6 months to 5 months. Secondly, they have recommended that the eligibility for the booster be increased down to age 12, between ages 12 and 15. Right now, it's approved for ages 16 and above. And they have also recommended that a third dose, which is different than a booster dose, be offered for immunocompromised children between the ages of 5 and 11. And this is specifically for the Pfizer vaccine. One quick comment about the process here. So when we have a new vaccine, and we've gone through this with every iteration of these vaccines, the FDA first issues an approval after the information has been given to them and their advisory committee has met and made their recommendation. Subsequent to that, the CDC takes that guidance and information, and the CDC director, along with the Advisory Committee on Immunization Practices, ACIP, will then look at those recommendations and give instructions to the medical community in how to implement those recommendations. So where we are right now, the FDA has made those 3 recommendations. The director of CDC, Dr. Walensky, has recommended that 2 of them be implemented. That would be the third dose for the immunocompromised children and the shortening of the interval between 5 and 6 months. The ACIP is actually meeting this afternoon and will issue a recommendation on whether the booster should be extended down to age 12. So we anticipate that they'll probably confirm that. The county sites are prepared to schedule appointments starting as soon as tomorrow morning for the age 12 to 15-year-old, assuming that the ACIP and CDC director do make that recommendation this afternoon. And with that, I will turn the program back over to Dr. Arkush.
Great. Thank you, Dr. Lorraine, for that really thorough vaccine update. Next, we're going to turn over to Dr. Wong, Alvin Wong, who's the Chief Medical Officer at our Department of Public Safety and our Regional EMS Director, and also an emergency medicine physician. And Dr. Wong is going to share with us some information about our hospitals here in the region. Dr. Wong?
Very much, Dr. Arkush. So if we can put up the PowerPoint, please. Today, we can see that there are 478 individuals with COVID-19 who are hospitalized here in Montgomery County. Of those, 78 are in the intensive care unit, which represents 16% of those who are hospitalized, and 34% of these patients, or 34 of these patients are on a ventilator, which represents 7% of the hospitalized. Our hospitals remain busy with increased patient volumes across the board. Some of this is normal for this time of year, and as you can see, some of this volume is directly related to hospitalizations from COVID-19. We are in regular communication with hospital leadership teams, and they are all working collaboratively to ensure that our Montgomery County residents remain able to access these critical hospital services. We thank all of our emergency services and healthcare workers for their ongoing dedication to providing these critically needed healthcare services to our residents and visitors of Montgomery County. As a practicing emergency physician, I have been asked many times about when people should call 911 or seek care at the emergency department. And so if we go to the next slide, I wanted to talk about some of these reasons. So our area emergency departments are open and are ready to provide care should you need it. They take infection control precautions to make sure that you and your loved ones are safe and protected while in the emergency department. And if you have a serious medical condition, it's important to seek care right away by going to the emergency department or calling 911 if you need an ambulance. Some of these serious medical conditions include things like wheezing, shortness of breath or difficulty breathing, chest pain, significant wounds or fractures, fainting or dizziness, sudden numbness or weakness in any part of the body, bleeding that can't be stopped with 10 minutes of pressure, sudden inability to see, move, or walk, severe abdominal pain, coughing or vomiting of blood, changes or confusion and alterations in mental status, fever or seizures, severe headaches or head injuries, or blood in urine or bloody stools. Again, these conditions do require emergency care, and the best place to get this care is at an emergency department. I do also want to remind people that the emergency department is not the place to go, however, for routine COVID-19 testing. We do have numerous PCR testing sites available for your use, and there are many private testing options available as well. Thank you very much. I'll turn it back to Dr. Rakush.
Thanks, Dr. Wong. And thank you for your work in the emergency department here locally every day. We really appreciate that. Next, we are going to hear from Christina Miller, Administrator for our Office of Public Health. She will be giving an update on the testing available here in the county.
Good morning, everyone. Over the past 20 months, since July 2020, Montgomery County has continued to provide PCR testing in our community. Currently, the county operates 5 PCR testing sites across the county. Appointments can be scheduled up to 4 days in advance, and walk-ins are not accepted at this time. As we're all aware, the demand for testing has increased significantly during the last month. During the month of December, the county administered more than 18,000 PCR tests. That's more than double the number of tests that were administered in the month of November. By the end of the month, we were averaging 1,200 tests per day. We know that in-person testing resources throughout the county are strained, as they are across the country, and at-home tests are equally difficult to secure right now. We are currently working to expand testing capacity and accessibility. Beginning next week, we expect to add more than 1,500 weekly appointments, or 6,000 appointments over the course of January, through our testing sites. In addition, we are working to secure at-home antigen tests for distribution to critical populations and frontline workers. We will share additional information about both as those details are finalized. In the meantime, those who are experiencing COVID-like symptoms and are unable to locate a test should isolate for the recommended 5 days to keep from spreading the illness to others. Individuals should monitor their symptoms and contact their primary care provider for guidance, particularly if they're at high risk for severe COVID or experiencing symptoms that are concerning. As Dr. Wong shared, preserve the emergency room for emergencies. If an individual is experiencing emergency warning signs like trouble breathing or chest pain or pressure, seek emergency medical care. But again, the emergency rooms are not for testing. A few things that we can do to preserve the testing resources that are available to us during this high time of need. If you're planning to travel, for example, tests can be ordered online and usually shipped within a few days. With some planning in advance, even a week or two of lead time, tests can be shipped directly to individuals so that they don't have to scramble to book an appointment. And those testing slots can be available to individuals who are experiencing symptoms, something for which no one can plan in advance. In addition, if an individual books an appointment and then no longer needs it, they can cancel that appointment. And canceling an appointment frees up a test for someone else, a friend, a neighbor, someone else that may need one. Thank you very much. And with that, I'll turn it back to Dr. Rakush.
Thanks, Christina. All right, so I know that a lot of people have been a little confused or lost track of the current CDC guidance for isolation and quarantine. So I'm just going to review the guidance that came out about a week ago now at this point from the Center for Disease Control. If you test positive for COVID-19, and regardless of your vaccination status, you have a positive test, doesn't matter if you're vaccinated or not, you should stay home and isolate for 5 days after your symptoms begin. If you have no symptoms at all, you should still stay home for 5 days from the time that you were tested. If you have no symptoms or your symptoms are resolved after 5 days, then you can end your isolation and leave your home. But you should wear a mask around others for 5 additional days after ending your isolation. If you want more information to know how and when you should isolate or quarantine, we have that linked for you, and we always update this. So if the CDC updates their guidelines, you can always come back to the same place and get the most updated version. You can find that at our COVID-19 page, which is www.montcopa.org/COVID-19. So that's montcopa.org/COVID-19. When you get to that page, scroll down and look for testing. There's a header that says testing. And under that, there will be a link to the CDC's latest isolation and quarantine guidance. So before I take questions, I want to acknowledge and thank our frontline workers. They have never missed a beat throughout this pandemic. Our grocery store clerks, our first responders, our public transportation workers, our pharmacists, so many of our county employees, and of course, our frontline hospital workers. They need our support now more than ever. They are exhausted and they are frustrated. Our hospital workers have been here for us for 22 months, and now we must be there for them. We all hope that this pandemic would be in a different place by now. But the reality is that this virus is tenacious and it's not going down without a fight. But guided by science and data, we have a lot of fight left and so many tools to use to beat this thing. If you're not vaccinated, get vaccinated. It's time. It is the very least that you can do to honor all of those frontline workers and protect our hospitals and your family and friends. If you're due for a booster, get boosted. Wear a mask indoors. Keep gathering small and limited to vaccinated individuals, and if possible, have them outdoors. Let's continue to pull together and do everything that we can to make this wave the last wave. So thank you, and now happy to open it up for questions. Kelly will give directions about how that's going to proceed.
Thank you, Commissioner. For those members of the press logged in today, you can use the raise your hand feature to indicate that you have a question, and we will call on you in order. We are asking that you please limit your questions to 2 per outlet so that we can get through the first round of questions, and we will be happy to take additional questions at the end if time allows. Our first reporter is Jim Melwart with KYW.
Hey, Val.
Morning.
You're doing all right with your infection here. Hearing a lot about how in other countries, hospitalizations and deaths have not tracked case counts as they have in the past. What are we seeing in Montgomery County?
Yeah, so I think we are seeing something similar here. We have the highest number of cases that we have seen to date during this pandemic. Yet, thankfully, at least at this point, hospitalizations are not keeping pace with that. In fact, as of today, we still have fewer hospitalizations than we had at the peak of this pandemic. Now, as we've talked about many times in these briefings, hospitalizations do lag a bit from the time of infection. So I would not suggest that we are in any way out of the woods yet, but it's certainly encouraging that we have not seen a similarly rapid rise in hospitalizations as we have seen with the number of cases. And I'll just ask Dr. Wong if he has anything else that he wants to add to that.
Nope, that's perfect. Thanks, Dr. Akish.
A quick follow-up to that. I've talked to Dr. Lorraine a few times about the balance of safety with the downsides of mitigation efforts. What are the important metrics? Is it still case counts and positivity rate, or do we start to look at outcomes like hospitalizations and deaths as you guys make those decisions?
Well, as I reminded everyone at the top of this briefing, we are in such a different place than we were a year ago. Guided by the data and the science, we have a number of things in place now that are tools to both prevent people from getting sick, number 1 being vaccines, number 2 being masks, and also the ability to treat this virus in a much more effective way. So at this point, the issue that is most critical would be if our hospitals got to the point where they were not able to admit any more patients or had the staff to care for more patients. That is the metric that we are tracking most closely at this point.
Okay, our next reporter is Justine McDaniel with the Philadelphia Inquirer.
Hi Hi, Commissioner Arkush. Nice to see you. Can you talk a little more about healthcare worker staffing shortages due to people being out with COVID and how that may be affecting hospitals, testing sites, vaccination sites in the county? And are there any resources the county is hoping to send or you're hoping to get support from the state or the federal government with? Just kind of what's the general impact and level of concern about those staffing shortages right now?
So, as has been the case from the beginning of this pandemic, we remain in regular communication with the hospitals here in Montgomery County. And to date, the number one request from the hospitals is the request that Dr. Wong shared with you, which is to please use emergency departments only for true medical emergencies. And I do want to stress our emergency departments are very safe. They are run very, very carefully now with all mitigation measures in place. So you should absolutely not hesitate to go to the emergency room if you're having a medical emergency. But what the hospitals are asking is that if you just want to be tested or have a more minor complaint that could be dealt with through your primary care doctor or at an urgent center of some type, that you go there rather than the emergency room. So far, our hospitals have not asked for any kind of supplemental or emergency staffing. But again, just to underscore Dr. Wong's comments, they are quite full. It is a combination of patients with COVID, patients with other medical conditions, and the fact that our frontline workers are exhausted and they have lost some of their staff. Staff have retired, they have quit, and this has not been a particularly easy time to recruit new staff. And this is why we continue to stress the importance of vaccinations. One of the reasons to get vaccinated is not only to protect your own personal health, but to help reduce that pressure on our hospitals.
Thank you. And then can you just talk about what you think the next few weeks are going to look like? A lot of people are saying it may peak within several days, so it complicates the response because resources are needed like immediately, and then it may fall off. So just kind of, can you give us a prediction and how complicated the response is right now?
Yeah. So, I think that your point about when you need to scale up resources quickly is just such an important one. And it's why, again, using the data and the science here in Montgomery County, we've never closed our testing sites. They have been here throughout this pandemic. And so we have been able to scale up the availability of testing here relatively quickly. So we're very pleased to be able to serve our residents in that way. But there is some national modeling that suggests that this particular wave is likely to peak probably closer to the next week or two. We will just have to see. We know this virus has surprised us before, but I am cautiously optimistic that we will see a peak sometime in the next 2 weeks, and then hopefully it will start to come down.
Okay, thank you. We will move on to Deanna Durante with NBC 10.
Good morning, all. I have a couple of questions. Just last week, we did an interview with the health department talking about testing, and it was everybody should get a test. If you want a test, you should go get tested. But you had then issues where people who needed those tests to either go back to work or school or were sick trying to determine couldn't get testing appointments, whether it was through the county site or through some of those private care places for over a week, which then led people in that zone of not knowing, do they have it? If they've been exposed, could they be passing it along? So am I hearing that you're now trying to just encourage those who have a reason to be tested other than they want to gather with grandma or go to a party, that if you have symptoms to be tested? Or is it still the position of the county, anybody who wants a test, you should try and get one of those appointments?
So we are doing everything we can to rapidly increase our capacity, but it is correct to say that we have, particularly last week and this week, filled all of the available appointments that the county has. And so as a consequence, we would urge anybody who can plan ahead. And I think Christina put this extremely well. If you know you're traveling in a week and you want to or need to be tested for that travel, see if you can obtain a test through the mail, through perhaps one of the online resources, so that you can just take that particular test somewhere else And that frees up a test for somebody here in the county who needs it because either they're having symptoms or they need that test on a certain day to go back to work or to go back to school. So again, we're just trying to triage it a bit and asking folks who are in a situation to plan ahead to do so. But otherwise, we do encourage people to get tested. It is one of the best strategies to stay safe and limit the spread of this virus.
Any talk of adding more mitigation measures, such as, Philadelphia, you can be on one side of City Line Avenue and the rules are different than on the other side. And I know that I've heard this particularly from those who work in our hospitals, as well as those who are trying to staff schools, that is a major concern, that you can have people who want to come to dinner in Montgomery County that aren't vaccinated, but in Philadelphia, you have to show your card.
So we have used all the science, all the facts, all the data to inform this community from day one of this pandemic. And we have been really clear about how to stay safe and which mitigation measures to use. We just have gone through all of them during this briefing. And so again, we encourage vaccinations, we encourage boosters, we encourage wearing masks indoors. If you're gathering with people, we encourage that be individuals who are vaccinated. And we will continue to share that guidance with our community. And if there's new measures that come in, we will share those as well. But folks know what to do. We just are encouraging you to do the right thing to protect our hospitals, protect yourself and your family and friends.
Okay, we're going to get into a second round of questions unless others have their hands raised. I'll just give it a second. Okay, we're going to go back to Jim Melwert at KYW.
Not to sound repetitive, but just to kind of put a bow on what I had asked. And I know the info's been covered, but to put it all into a nice broadcast quote, you said looking at hospitals being able to admit is a very important metric. So kind of wrap that into how Montgomery County hospitals are doing it and what that looks like right now.
Right now, Montgomery County hospitals are full, but they are managing the case volumes that they are seeing. Some of our hospitals are considering putting off elective procedures, but for the most part, they are managing and have not asked for specific additional staffing help. However, they are asking that people not use emergency rooms unless they are having a true medical emergency, and that anything that is around just routine COVID testing or other primary care matters be done through their primary care doctor or through an urgent center.
And so as you're using that to make decisions, that's not pushing you to increase, as you just said, you're educating people, but you're not considering additional restrictions. And so there's nothing happening in hospitals right now that is concerning you to the point where you're starting to think about we might need to do something.
So we are in regular communication with all of our hospitals in our county. And right now today, there is nothing that is indicating that we need to take any further steps than the ones that are currently in place, which is to strongly urge vaccination and boosters, strongly encourage indoor masking, and limiting gatherings to small numbers of fully vaccinated individuals.
Thanks much.
Okay, we'll go back to Deanna Durante at NBC 10.
I was curious with our testing if the county sites or how it's working when it comes to trying to detect which variant seems to be most prevalent in the county. Do we know for sure now that it's Omicron, and are we now saying that could be why people have less symptoms or don't know? Just kind of what we know about its prevalence here.
Yeah. Christine, I'm going to kick that one over to you. She's most up to date on the viral sequencing that's happening.
Hi, thanks so much. So I would say that within the county, not every specimen is able to be tested or sequenced rather. However, a large number of them are. I don't have the most recent figures at my fingertips and would be happy to follow up with you to share that information.
And then while we're on testing, are you able to contact everybody that has a positive test to let them, I mean, is the health department still making those phone calls to people, or is it just the email alert, you got it? And we're not as contact tracing as we used to be?
So for notification of a positive test result, individuals should receive that via email. In terms of contact tracing, the volume is very high. The volume is very high, and we do prioritize certain populations for contact tracing, typically children, older adults, and individuals that are immunocompromised, or where there are clusters and outbreaks.
And just to add to that, I think that's a very important point, that because of the volume of cases right now, if you do test positive or you test positive at home with an antigen test, then it would be extremely helpful if you would let anybody who you were in close contact with for the 2 days prior to your symptoms starting, or if you didn't have any symptoms from the day that you tested, let them know that you've now tested positive. And just as a reminder, a close contact is someone with whom you were within 6 feet of for at least a total of 15 minutes over a 24-hour period. So that's a step that you could take to help keep your family and your friends safe if you do test positive. Just let them know that they might have been exposed.
I just thought I would defer to somebody else because I think there's somebody who hasn't asked a first question yet.
Okay, we are going to go now to Rachel Ravina with Montgomery Media.
Good morning, Commissioner Akush. Thank you for taking my question. Most recently, from the time period of December 31st, 2021 to January 3rd, 2022, on Monday, there were 5,118 cases. That's approximately a 4,000 case increase from the previous update from December 29th. Did the county anticipate this type of increase in this volume in a short amount of time?
So we, of course, have been watching what happened in South Africa, and this is part of why we are working under the assumption that this is the Omicron variant that is fueling most of these cases. This is an unprecedented rapid rise in cases, and no other variant has caused anything like this. So we assumed that it was probably coming, but it sure came fast and hard.
Sure. And the amount, did the county anticipate that it would be quite this much? Usually the cases, if they're more steadily increasing or over a shorter period of time, 4,000 cases in just a few days is quite a large increase.
Again, we had been watching what happened in South Africa, where they had seen similar increases of this similar rapidity. And so we were on the lookout for that. And indeed, this is what we saw.
Okay, we are going to go back to Justine McDaniel at the Inquirer.
Hi, first, I'm just going to follow up on your answer to Deanna's last question. Should people who test positive at home report that in any way? Are you worried about the undercount?
So we have created a portal for individuals who test positive at home to report that. And it's very easy to find. It's at montcopa.org/COVID-19, and scroll down to that testing header. And there is a link under that section of the page where you can self-report your home test. And we would encourage people to do that. It will help us have a more accurate count of the total number of cases here in the county.
Great. And then do you think that Pennsylvania should have a statewide indoor mask mandate? If there were one for the next couple of weeks, would that help stem the tide of this wave?
I think that people should follow the data and the science, and they should use the tools available to them to help mitigate the spread of this virus, help protect the hospitals, help protect themselves, their family, their friends. One way to do that, the most important way to do that is to get vaccinated and to get boosted if you're due. And the second way to do that is to mask indoors when you are around individuals that are not part of your household. So we continue to, in the most strongest terms, encourage people to wear masks indoors. Masks work to help reduce the spread of this airborne virus.
Thanks. If I have time for one more, I was wondering if you guys have done any research yet or been able to find anything yet on breakthrough cases with Omicron specifically, or just heard from your hospitals what you're seeing with vaccinated versus unvaccinated patients?
Christina, do you know if we have any of that data yet?
With regard to breakthrough infections, I believe the data is regularly available through the Pennsylvania Department of Health. We can certainly pull the data specific for the past few days and forward that to you if that would be useful.
Okay, and this is our last call for questions. We will go back to Deanna Durante.
Okay, just ignore that last one I put in the chat then. I'm curious, you're talking about getting more testing supplies. Where's your allocation coming from? Are you dependent, like with the vaccines, on the federal government, or do you buy them from someplace? How can you try and up your supplies there?
Christina, do you want to talk about the steps that we're taking to make testing more readily available here in the county?
Absolutely. So 2 forms of testing we are planning to expand. One is in-person testing through our 5 county sites, and the testing supplies for that come through our provider and our lab. The other testing option that we are looking to expand access to is at-home antigen testing, and we are able to work through our network of vendors to secure testing in the same way that other municipalities, states are providing at-home tests to their residents.
Right, but we've heard that the at-home testing isn't as strong, or you actually need to be sick. But if you're going for your PCR, which many people are required to have to return to things like schoolwork, those kinds of things, is the lab able to get more tests? Do they buy them from a vendor? Do they get them from the federal? Like, what's the supply stream for that?
I can't speak to our vendors' supply chain, but we do know that we are able to secure additional testing supplies specifically for in-person PCR testing. I see Dr. Lorraine has also joined the conversation here and can perhaps speak a little bit more in detail to that question.
Yeah, so to clarify the process for our county sites and PCR testing, what that involves is collecting a specimen on site and then sending that to our central laboratory for testing. So the capacity is limited only to what the central laboratory can do. And they have a fairly large throughput, and they have additional capacity that we are able to utilize. So that's actually not difficult for us to increase. The local supplies are basically just swabs, which we do have an adequate supply of. And the only limitation would be the throughput at the central lab, and they are able to accept more. So we are looking to expand that.
Okay. So now I'm confused, because if it's not difficult to increase the actual testing, granted, you'll have to have people wait longer, but at least then they can get more appointments if you have the supplies, rather than wait a week to try and get an appointment.
Right, and that is exactly what we're working on. There are other logistics involved here. Most noticeably, like everyone else, there's a staffing issue. So we have to have trained personnel available to be able to staff the sites. And our resources, of course, have been stretched very thin for a very long time. And we salute all of our workers who have put in so much time and effort to this. And we are looking at where we can efficiently shift people from one site to another to be able to utilize that as well. So it's not a question of supplies, it's more staffing than anything else.
And what the lab can handle, how much the lab can process, which is also staffing, but it's staffing of the sites and then what the labs can actually process.
Correct.
Which is why the appointments are limited. Okay.
Okay, and our final question will go back to Jim Melwert.
Deanna triggered my brain about you mentioned the oral, the pills from Merck and Pfizer. What is the availability and what is the expected availability over the coming weeks in Montgomery County?
Dr. Lorraine has been keeping a very close eye on that, so I'm going to kick that one over to him.
Yeah, so potentially this has the chance of being pretty significant in terms of changing how we are able to deal with the virus. The initial supplies of the Paxlovid, the Pfizer drug, were somewhat limited and are in the process of being distributed to each of the states. The last information I saw was that about 65,000 doses are being distributed to Pennsylvania in the upcoming week. And of those, roughly 2,000 will come to Montgomery County. That's a very small amount when you note that we're having, upwards of 1,000 cases a day sometimes. But this is in the near future, and the expectation is that the availability is going to increase very dramatically. We're working out the method by which physicians will be able to prescribe this medication. My understanding is that the federal government, and particularly once they distribute to the State Department of Health, has designated a specific distribution network. So there are specific pharmacies within the state who will be carrying the medication, and then physicians will prescribe for their individual patients to these pharmacies.
And so as part of that, is there kind of a priority on who would get it?
There is a definite schema that the CDC has recommended, and it's pretty similar to what we've seen in terms of the risk for severe COVID. Hopefully, this information gets out to individual practitioners. I know they're following this very, very closely. I've gotten a number of calls from practitioners within the county so that they are looking at that particular schema in terms of how to prioritize these prescriptions. Obviously, for example, the most concerning would be someone who is unvaccinated, but particularly with multiple comorbidities. We're looking to basically prioritize people who are potentially going to become severely infected or ill for the treatment until it becomes more widely available.
Thanks.
All right. Thank you, everybody.